There is a reason why they say your health is your wealth. And today we'll be looking at health matters. And joining us live from Malawi is Maziko Hisbon Matemba, Executive Director of Health and Rights Education Program, with over 10 years of experience in health policy advocacy in key health systems, and has performed a number of national and international campaigns. I read your profile and it talks about so many things about health. I would have maybe ventured into health, but anyways, we stuck with journalism. So we want to get more perception about what we call cancer. And from what we have seen, cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. Now, when you go online, the National Institute of Cancer refers to cancer as a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Now, that's just what we're seeing in mere definition. As a health expert, what exactly is cancer and how does it actually affect the body?
Normally, in simpler terms, because we're talking to the listeners, people from different levels of understanding of health care, but also we need much of the health literacy among populations to understand about their bodies. In simpler terminology, I think cancer is a lifestyle disease, meaning that it's a lifestyle disease that if you overdo certain things, it can lead to cancer.
Medical migration has become a global trend. While it may be beneficial to destination countries by helping them sustain their health systems, it has proven to negatively affect the health systems of source countries. Unfortunately, Africa seems to suffer the downside of this, while countries such as the United States, the United Kingdom, Germany, Ireland, France, Switzerland, and many others have become hotspot destinations for many of these migrating doctors. According to recent data, the WHO assessed that there is a current shortage of 2.8 million physicians in the world. Around 220,000 out of 1.4 million NHS staff report a non-British nationality. The reason for medical migration seems not far-fetched. Poor working conditions, employment opportunities, better training and development opportunities, better quality of life, desire for a life change, and financial reasons.
You will agree with me that a lot of our politicians, when they fall sick here in Africa, they don't use the same medical facilities that they want, the African ordinary people to use, because they realize that they're much poorer and they're not capable, of sustaining their lives, and hence they have got to buy, the medical services, from other countries. And some of those medical facilities which they buy from are actually run by people that are from Africa anyway.
2017 statistics show that 71% of African countries, up from 46% in 2013, had operational national cancer control programs. Earlier on, you just talked about what made you go into oncology. Now, what exactly is the current state of cancer care across Africa? Is it worsening, or are we improving in the cancer care in Africa?
So, like you rightly started of talking about the National Cancer Control Programs, as far back as, where 2008, when you referenced, we didn't have cancer control plans as readily available as we have them now. Now, just to put it into perspective, a National Cancer Control Plan is almost like a roadmap, trying to identify cancers that are more prevalent, identify some of the gaps, and essentially put a roadmap to trying to mitigate and solve those problems, whereas also putting in financial investments into making that happen.
Unsafe food containing harmful bacteria, viruses, parasites, or chemical substances causes more than 200 diseases, ranging from diarrhea to cancers. The World Health Organization reveals that an estimated 600 million, almost 1 in 10 people in the world, fall ill after eating contaminated food, and 420,000 die every year, resulting in the loss of 33 million healthy life years.
Displaying the consumable items by the side of the road, places where there are deaths, like close to dumps and all that. And here you find flies flying all over the places, perching on the food that we are supposed to eat. And so you find, for example, people who fry yam, fry all this pastry, pop-off and the rest. And a lot of people consume this thing. You find it at almost every joint. that you pass along the way. But then you realize that these things have been exposed. They're not even well covered. Flies, everything comes into play. And at the end of the day, we just consume the food directly.
I would just say that they should be careful in terms of making sure that they're eating clean and sanitary foods. So just watch where the source of where your food comes from. If you're buying food from the market and you're taking it home to prepare it, make sure that you're washing it. If it's fruits and vegetables, some people even use salt to wash the vegetables and make sure that they have been cleaned sufficiently.
Point that it gets into the body system and begins to cause a particular disease which has a set of symptoms. Most of the symptoms we have actually is what we call gastroenteric, in the sense that it involves the stomach and the intestine, in most cases, primarily in that area.